Hi guys, Dr. Lipnitsky with ReBalance, trying to answer some questions regarding Shockwave. Great form of treatment for any chronic musculoskeletal conditions. It doesn't matter whether it's ligament, muscle, or tendon. The healing process always generates a lot of scar tissue. That changes the integrity of the muscle. Muscle loses flexibility, it loses strength. The same thing happens with ligament, the same thing happens with the tendon. Shockwave is designed to mechanically destroy, break away the scar tissue, almost disintegrate the scar tissue, restoring the integrity of the muscle. Of course, it's better when it's combined with some skilled manual therapy techniques and stretching, but on its own, it's an amazing tool to enhance regenerative process. It also stimulates formation of new cells. So the muscle, ligament, and tendon actually heals much faster with the original muscle, tendon, or ligamental cell, which really returns the muscle to its normal function. Few words about Shockwave. Shockwave is a great equipment if it's used correctly. It's used primarily to break the scar tissue, to restore the integrity of the muscle, ligament, or tendon, and we see quite a bit of it in runners. Anything from runner's knee, iliotibial band, tensor fasciolata problems, plantar fasciitis problems, so feet, ankle, knees, hips, even lower back is commonly treated with Shockwave. Great way to break the scar tissue, great way to enhance the healing process and regenerative process of the ligaments, tendons, and muscles. So highly recommend. I've been doing it for many years, probably one of the first physicians who started using Shockwave and going very strong with it, treating multiple conditions, some of the stuff that majority of people don't even challenge to treat. So definitely go on the website, read more about it, come by. We'll be happy to answer your questions and do a quick consult. Anybody who has chronic condition that entails soft tissue injury, please come by. See you later.